UBCO's harm reduction team presentation. You've probably just got the notification that we will be recording today's presentation. So the recording should just appear as the slides and the presenter, but you can feel free to have your video off as well, since this is the format that we'll be using for the presentation. So I just wanted to welcome everyone by starting with a land acknowledgement and noting that I am an uninvited guest on the unceded traditional territory of the Okanagan Silex Nation. And I would encourage everyone as we go through today's presentation to just keep in mind the territory that you're on, and keeping this lens sort of on the work that we're doing and thinking about what our different roles have been in perpetuating different stigmas and discrimination, and knowing the systemic issues right now around that are really coming to light, I guess, around our relationship with First Nations people, especially here in BC, and just thinking about what role we can play in decolonization and what that looks like in each of our job roles, in our homes, and those sorts of things. So I'd encourage everyone as well to just introduce yourself in the chat. If you can include your name, your pronouns, and a territory acknowledgement of where you are. If you'd like to include your pronouns in your name as well, you just hover over your video, and you can use the three little dots to change your name, and you can add them in at the end. So good time to actually introduce myself. My name is Lauren Erth, and I use the pronouns she, her. And I am a campus health specialist at UBCO Okanagan, and I'm also a doctoral student in nursing at UBCO Okanagan as well. And I'm a registered nurse specialized in mental health and substance use. So that's part of what brought me into this space and in this work that I'm going to talk about today. As different members of the team make appearances throughout today, they'll introduce themselves. And just wanted to note that some of our team members couldn't make it here live today, so we do have recordings that will play of them going over the selected slides that they'll be reviewing. So hopefully those recordings go over without a glitch, but just acknowledging that technology isn't always perfect. So hopefully that goes well. And if anyone has questions, comments, anything like that, please feel free to pop them into the chat. And just if you can remember to include a reference to the slide that you're talking about, we're going to hold off on questions and comments until the end, and we'll go over them all then. So we've tried to leave ample time for being able to go over everyone's questions. And if not, you can always send us an email afterwards. My email is there on the screen. So we're just going to move into some shared definitions here at the start so that we are all on the same page.
Hi, my name is Tori Bester. I go by the pronouns she and her. I am currently part of the harm reduction team, and I'm working as a work study student. To start off the presentation, we just wanted to go through some of the definitions we use on a daily basis so we can all be on the same page. So the first definition is public health. And so in a shorter sense, public health just means that there are avenues for people to access for services, programs, and policies within their own communities. And health promotion is the ability of one to take their health into their own hands and improve their well-being. So these go hand in hand, as when someone is engaging in health promotion, they would be accessing the program, services, and policies available through public health to improve their own health status. And then some of the next definitions we have are harm reduction and peers. So harm reduction is the client-centered approach that is used to reduce the health and social harms associated with addiction and substance use without the person having to necessarily stop or abstain from using the substance. Peers are those who have the understanding of substance use and take their lived experience to provide effective health service programming and delivery. So these work together, as harm reduction and peers have the same objective to reduce the risks for those within that population. They can work together to create a holistic approach of evidence-based work and lived experience perspective. Hi.
Hello, everyone. My name is David Byers. I use he, him pronouns. I'm an international relations major at UBCO Okanagan, and I am also a campus health work study student. I'm presenting today from the unceded Musqueam, Stolos, Dominus, Kwantlen, and Tawasin territory. So to start, we wanted to provide some context on our work and our role in the community and the public health, and we wanted to have everyone on the same page about the current crisis. The public health emergency due to an increase in opioid-related overdose deaths was declared in BC on April 14th, 2016. And as I am sure you are all aware, we had a second public health emergency that emerged in 2020, that being the COVID-19 pandemic. This dual emergency has led to a worsening toxicity of the drug supply. We currently see illicit fentanyl and its analogs causing the majority of overdose deaths. These overdoses are reversible through the use of Narcan, which has been publicly available since 2016. What we now see in BC is a rise in benzodiazepine being mixed with fentanyl and down. This is worrying to us because the mixture can worsen overdoses, as benzodiazepines do not respond to naloxone. Administering naloxone is still advised as it can reverse the effects of any opioids consumed and will not cause further harm. In 2020, approximately 5 people a day died to the drug toxicity. Currently, approximately 6 people a day are dying due to the toxic drug supply. 2020 set a record for the highest number of drug toxicity deaths recorded in BC. 80% of those deaths were male, and 70% were in the 30 to 59-year-old age group. We also want to acknowledge the ongoing structural inequities that cause First Nations people to be disproportionately affected by the toxic drug supply. First Nations people represented 16% of overdose deaths, despite making up only 3% of the general population. We also want to highlight that the majority of these deaths are occurring in private residences. Using alone has in part been due to the stigma surrounding substance use, which forces people to hide their substance use and not seek appropriate services. This has also been affected by the ongoing pandemic, as people have been trying to reduce their social contacts. Using alone is extremely dangerous, which is why we constantly encourage people to use together or use one of the services such as the Lifeguard app or the National Overdose Response Service. The crisis has also contributed further to inequities, as the First Nations populations face a higher risk of overdose death than any other group in the population. The First Nations Health Authority reported that First Nations people are 6 times more likely to die from an overdose, while First Nations women are at an even higher risk, being 9 times more likely to die from an overdose. This is of great concern to us, especially with the high numbers of First Nation students at UBCO Okanagan and the systemic inequities that contribute to these concerns. The age group that contains many university students, 19 to 29-year-olds, recorded 306 deaths in 2020, which is high and in part shows the heightened need for interventions and resources on our campuses. Health Canada's 2019 to 2020 survey of post-secondary student substance use found that 15% of students had used illegal drugs in the past year, 15% had used a pain reliever, stimulant, sedative, or over-the-counter medication in a problematic way in the past year. 56% of students reported physical harm as a result of their alcohol use, and 19% reported signs of alcohol dependency. Reducing harms related to illicit drugs as well as legal substances such as alcohol and smoking are highly important to us. In 2020, Kelowna saw 61 illicit drug toxicity deaths, and by May 31st, 2021, has already seen 19 more. This shows clearly the need that this community has for harm reduction and overdose prevention services.
Thanks for going over those stats, David. I feel like it's really helpful just to situate us all with, to make sure we're on the same page with what we're looking at and why we're doing this work. So I wanted to go over organizational structure briefly, because I know this is a question that comes up often for people, and it's a bit confusing because universities haven't historically been involved with these sorts of services necessarily in this way in the community. And I think it puts us in a really unique and a really cool position to be able to work with the community in this way. So For our organizational structure, we have UBCO, Interior Health, and Community Organizations. So if we go to the next slide here, UBCO Campus Health. UBCO Campus Health is the organization that most of the people you're hearing from today work for, and that department focuses on researching, creating, promoting, and delivering harm reduction services on campus. And for the harm reduction team specifically, it's made up of a campus health specialist, which is me, and then we have 5 different work study students, which we're really, really lucky to be able to have join us and contribute to the work. And then we have Interior Health, and within the harm reduction team, Interior Health contributes by providing drug checking oversight and planning through the harm reduction coordinators. So they have the harm reduction coordinators who help oversee the drug checking part, and then Interior Health, through the contract that we hold, also contributes to funding for myself to oversee parts of the drug checking program, and for the FTIR technicians, or the drug checking technicians, who provide these services in the community. And then we also have community organizations that facilitate this drug checking. So in Penticton, that's the South Okanagan Women in Need Society. In Kelowna, that's Living Positive Resource Center. And in Vernon, that's the Interior Health, Mental Health, and Substance Use site downtown. So that's kind of the division of what the key partners look like for the harm reduction team. And then to get into the structure a little bit more as far as UBCO goes, UBCO is on the ancestral unceded territory of the Okanagan Silex Nation. And within UBCO, Campus Health is under the direction of the Institute for Healthy Living and Chronic Disease Prevention and the Health and Wellness Clinic. So the Voice Campus Research Project, which you'll see referenced throughout this presentation, is kind of the overarching body of work that we contribute to in Campus Health. And so that includes a number of different student wellbeing pieces, including physical activity, healthy environments, mental health, harm reduction, and we're doing a lot of good work on food security right now too, which I'd encourage you to check out. And the harm reduction team is then a key part of that work. So to explain a little bit more about exactly who Campus Health is and why they are the department basically that's supporting this work for the community, is they partner with the community members at UBCO to explore different health-related issues and to develop initiatives to address those health issues. So by engaging different stakeholders on campus and from the larger community, researchers, health professionals, that kind of thing, we try to come up with really innovative solutions for problems that are identified by students. And that's one of the reasons I think Campus Health has a really strong body of work, is because it really takes into consideration the experiences of peers, to use that language, and thinking about what matters most to the population that we're working with and what solutions do they think are most viable. So that's how we make the decisions about the work that we're doing. And Campus Health has a long history of engaging in harm reduction at UBCO. So this isn't something that's new, although the work that we're doing is with drug checking is something that's come along in the last few years. But you can see on this slide here that since 2008, and even before that, really arguably with Okanagan College, there's been a lot of work happening around various areas related to harm reduction. So that includes smoking and vaping cessation support, doing work around party culture on campus. And it was around 2016 when the epidemic was declared that the overdose prevention and naloxone training work really started. So you can see from there, there was just a massive increase kind of in the work that was happening around that. So I won't go through every single thing, but I think this kind of speaks to the amount of work that's been happening and has provided the foundation for us to be able to do the work that we're doing now. So on this next slide here, you can see all the different collaborators that contribute to the harm reduction team. So aside from myself as a campus health specialist, we also have Casey Hamilton, who does a lot of amazing work in food security, like I mentioned earlier. And then the co-leads of our campus health department are Roger Wilson and Joan Vitoroff, who are on the far left-hand side there, if you can see. Casey's right above the UBC logo, and then you can see Melissa there next to Casey. She's our well-being specialist. So she's been working in health promotion at UBCO for a long, long time, has lots of really valuable experience, and really all these people contribute to what the harm reduction team is and what you're hearing about today. And then we also have interior health and specifically the harm reduction coordinators who have made this all happen, basically, the drug checking aspect of our work at least. They're invaluable when it comes to the knowledge that they have and the connections they have in the community, as well as the BC Center on Substance Use, which I think a lot of people are familiar with the BCCSU, but just to explain a bit more about them as well. On this next slide here, you'll see this is just taken right off of their website, so you can head to their website if you want to find out more information, but they're a provincial organization that's really helped to push forward innovative practices when it comes to addressing the toxic drug supply epidemic that we're facing, and really heads the whole drug checking program for the province. So they manage the databases, they come up with best practices, they organize people into community practice meetings. They do tons of amazing work and are always trying to find what's working best or what could work better, and trying to support people working in this area and promote the work that's happening. So if you're not familiar with them, I'd encourage you to go check out their website as well and find out more about a lot of the incredible work that they're doing. There's a lot of really good literature and research on their site as well that we use to inform the work that we do. I'll pass it along to Thomas now to speak a bit more to the harm reduction team specifically.
Thank you. My name is Thomas Poole. I use the pronouns he, him, and I am a fourth-year nursing student at UBCO, a former member of the work study team, and I'm a trained FTIR technician. I'm joining you from the traditional and unceded territory of the Innu First Nations. So a little bit about the harm reduction team. The harm reduction team is composed of UBCO work study students and interior health funded FTIR technicians, working in collaboration with students, community organizations, and peers. Our mission is to decrease stigma, improve access to support, and advocate for person-centered policies, developing resources, delivering harm reduction services, and collaborating with stakeholders. There are a variety of different individuals who contribute to the harm reduction team work, and the most notable being our peers. We are grateful to have our peers with lived experience who ensure that our work is performed from an informed and culturally safe perspective. The HaRT staff is composed of an interdisciplinary team of students in undergraduate, graduate, and doctoral studies. We currently have 3 FTIR technicians on a temporary contract funded by Interior Health. Our work is further supported by 5 UBCO campus health work study students, as well as volunteers. We have developed a substantial network of support locally, regionally, provincially, and nationally, for which we are truly grateful. None of our work would be possible or effective without the shared experience and collaboration of our partners.
Hi, my name is John Kirsch. I use the pronouns he, him, and I'm also a fourth-year nursing student at UBCO, and I've been lucky to be with the harm reduction team as a work study student since February this year. And today I'm joining from the Treaty 7 territory, which is the traditional and ancestral territory of the Blackfoot Confederacy, the Kainai, Rikani, Sissiska, as well as the Tsuut'ina Nation and Stoney Nakoda First Nation. All of our work is done through the trauma-informed practice lens, or the trauma-informed care lens. We do this through the acknowledgement of the lived experiences of the individuals that we support and work with, and how these traumas affect their lives, and as well as acknowledging our own privileges and how that might affect our community as well. And we aim to empower communities with tools, resources, and supports in order to take control of their health. We collaborate with trusted community members to reduce stigma, offer education, and create a safe and accepting environment for everyone to access. And our work specifically, our work is built on a foundation of research-based evidence coming both from academic papers and research, as well as practical knowledge coming from our community, which is informed through dialogues we've held online throughout COVID, as well as collaboration with our community partners, such as the Living Positive Resource Center, CAN DO, which is the Kelowna Area Network of Drug Users, and UBCO as well, and UBCO students. And try to do our work a little bit outside the box with harm reduction, because it's work that isn't just about substance use, but it's about addressing and acknowledging the challenges and barriers that contribute to substance. Mental health and substance use often go hand in hand. And last year with COVID-19 saw an increase in dangerous substance use and overdose, which also coincided with an increase in mental health challenges, which include loneliness, anxiety, and others. And so just recently, we worked on a party bottle project that I'll talk about in a coming slide. And through this project, we acknowledge the isolation and loneliness that people have been experiencing throughout the last year, throughout COVID, and offered tools and resources for people to connect in lower risk ways. And the project also acknowledges that party culture and gathering is often associated with alcohol, substance use, and in those party bottles, we offered tools and resources to party in lower risk ways. That's all part of our vision and goal to empower people to, with knowledge, to make healthy decision-making around partying and substance use. The party bottles themselves are just kind of one of our unique ways that we're looking to connect with the community, and we're always looking for innovative and unique ways to connect with the community. And we did this with the funding we received from the 2MS initiative grant to create the Party Bottle Project. And this Party Bottle Project, we worked with UBCO capstone nursing students, members of the harm reduction team, and volunteers to assemble these bottles. And we distributed those to the communities of Vernon, Kelowna, Penticton, and with the intent of targeting university-age students who might benefit from harm reduction knowledge. And inside these bottles, it contained harm reduction supplies that weren't just substance related, but it included things like hand sanitizer, sunscreen, snacks, juice, condoms, information pamphlet on how to party and gather in lower risk ways, as well as a sample collection kit they can use to send in a sample if they'd like to get their drugs checked, and fentanyl test strips that somebody can use to test their own drugs at home. And additionally, if you see there, nice people use drugs, the bottles contain this sort of anti-stigma messaging on the bottles as well, reduce stigma around.
Hi, my name is Becky. I use she, her pronouns, and I'm joining today on the unceded traditional and ancestral territory of the Okanagan peoples. I'm a work study student with Campus Health's harm reduction team. And today I'm going to be talking about dialogues. So Campus Health dialogues, they stem from their participatory action research model. So what that actually means is that Campus Health engages in conversation with students. And we do this because we want to understand students' needs and be able to implement services that are based on their needs, and making sure that our service delivery model is actually effective. And just to be able to engage in conversations with students, to be able to brainstorm and collaborate on solutions that to problems that they might be having on campus. So Campus Health has done a series of substance use dialogues. And from these dialogues, we have really understood 5 main themes that students continually bring up. And so I'll go over these briefly today, just in the interest of time. But one theme that constantly emerges from our dialogues is stigma. Students are highly aware of the stigma that exists of being a substance user, but also being an academic, and that really dictates whether they access services on campus or off campus. Students are also not aware of resources if they are themselves struggling with substance use or wanting to support a friend or a family member. We also know from our dialogues that students are supportive of drug checking on campus. And students have also let us know that they really are wanting accessible, user-friendly, and reliable information when it comes to substance use and drugs in general. We also know from our dialogues the impact that COVID-19 has had on our student population and their relationship with substance use as well. So that has been really valuable information during this pandemic. And really, at the end of the day, this has allowed us to really enhance our already harm reduction services on Campus Health to be able to better meet the needs of our students.
Awesome. So as much as we have talked about drug checking and other projects, we also do have a lot of other things going on. So we are always working to provide services that are relevant to our peers and to our colleagues. While we focus a lot on our drug checking, because it is how we most often interact with peers and partners, we have lots of other work going on as well. You can see some of the other work we do on this slide. This ranges from naloxone training to policy and advocacy to workshops and referrals. Our team strives to provide the best services to as many people as possible within our limited capacity. In all of these areas, we seek the input of peers and are committed to evidence-based practices for everything we do. We want to ensure that we are following the best practices in every aspect of our work, and we are always striving to stay as up to date with new recommendations and research. If any of these areas of our work are of specific interest to you, I would encourage you to reach out. As a team of students, our capacity is limited. However, we will do our best to work with you or to refer you to relevant resources. Our contact information will be shared later in the presentation.
UBCO is able to provide our harm reduction services to our community in a variety of different ways. So this looks like providing educational content, and this can be found on our website, our social media pages. UBC students have access to this on the Wellness Center online. We also provide workshops through Campus Health that can be done on request. And if you're interested in workshops in the community, you can contact IH harm reduction coordinators. We also offer supplies during service hours at our service locations. We also refer out to UBCO's Problematic Substance Use Clinic, and so this is available to UBC students, faculty, and staff, as well as it's a low barrier clinic for the community as well. And also UBC students have access to the student recovery community. And so these are two really great resources that we refer out to quite often in our work. And of course, you can access IH supported drug checking during our service hours. And I will talk about this in just a second. So our drug checking is made possible through a partnership with Interior Health, and we hold the contract until September 30th, 2021. And then at this time, Interior Health will be reviewing proposals to see who takes on the next contract. But during the meantime, we are servicing 3 communities in 4 different locations. And so on Tuesdays, we're operating out of IH MHSU site in Vernon. Wednesdays, we're operating out of UBCO and Living Positive Resource Center in Kelowna. And then Fridays, you can find us at the center in Penticton. And of course, if you're having any questions about site-specific drug checking and service hours, you can contact the numbers on the screen there. In the next coming weeks, we're actually hoping to add in a few more locations that we can service with our drug checking. So this looks like adding IH's MHSU site in Penticton, as well as the Camille Lafleur outreach site in Vernon. And we're going to be starting something called Foundry Fridays in Penticton, and this will be made possible through the United Way Youth Initiative grant.
Perfect. So I'm going to introduce our work in policy. I want to start by acknowledging the policy that allows our team to exist and function in our current capacity. That is Ministerial Order M488. It was signed on December 9th, 2016 by then Minister of Health Terry Lake of the BC Liberal Party. This order invoked the ministerial powers under the Public Health and Emergency Health Services Acts to authorize overdose prevention sites. Currently, we operate under that order. However, we would like to see permanent, well-rounded policy enacted quickly to protect our peers and people who use drugs. As we have seen, this crisis is worsening, and the drug supply is becoming increasingly toxic. In order to combat this, we would like to see decriminalization and safe supply policies as soon as possible. The federal government, under the Ministry of Health Canada, has jurisdiction to decriminalize drug possession. The City of Vancouver has applied to Health Canada for an exemption for drug possession charges. The push for decriminalization has also been supported by Premier John Horgan, Provincial Health Officer Dr. Bonnie Henry, and the BC Chief Coroner Lisa Lapointe, among others. As announced on April 14th of this year, the BC Ministry of Mental Health and Addictions and Health Canada have been working together on an agreement that outlines how the province of BC will work with Health Canada to apply for the province-wide exemption to the Controlled Substances and Drugs Act, which governs drug possession. While safe supply was made available in a limited fashion as of March 2020, due in part to COVID-19 in BC, it is not without its barriers. We would like to see an expansion of the safe supply to reduce barriers and substance use-related harms, as the current structure leaves a large portion of people unable to access the safe supply. As with all our work, we believe that it is crucial to listen and respond to the recommendations of our peers and those who use drugs in our communities. There has been policy tabled in the federal government to address this crisis. This includes that of the NDP health critic, Don Davies, who tabled a bill to not only decriminalize, but also to expunge records of people with possession charges. The federal Liberal Party tabled a policy to remove mandatory minimum charges and to force prosecutors and judges to materially consider alternative sentencing regimes, including addiction treatment. Notably, many of the existing drug policies are rooted in racism. Provincially, despite the actions that I have already described taken by the BC government, the two opposition parties, being the Liberal and Green parties, are still asking for a special committee to be formed. This certainly is a pathway to cross-party cooperation and long-term progress that we will support. However, we ask for action to be taken as soon as possible and do not believe that a committee alone will meet the urgent needs of our community.
Thank you, David. David's our resident political expert, so go to him for all things on policy and really appreciate the viewpoints that he brings, because we need the support of policy and decision makers on our side in order to move this work forward. So we were hoping to have Can Do speak a little bit to their experience as peers working alongside us. And I know they've been really busy in Vancouver at I think it's a big sort of gathering basically of similar organizations right now. I'm just seeing, I don't see their names here in the participants, but I do know there's someone on the line on a phone. On the phone, if that is you, Can Do, you can hit *6, I believe, to unmute yourself. Otherwise,
can you hear me?
Yes, there you are. Hello.
Hi, Lauren. Hi, everybody. It's Heather here. Glad
Hi,
to be on the
Heather.
call today. Hi. I just want to acknowledge that we live, work, and play on the unceded traditional territory of the Silks Nation. And Lauren, you're just wanting us to let us know like how our relationship with your team has been.
Yeah, whatever you guys want to say about your experiences with us and the harm reduction team and drug checking.
I just want to say, like, and I can speak on behalf of our group, that it's been a good relationship, to say the least. And like having that relationship with a team that's as flexible as your team, Lauren, it's been a good network that we've created in the community and want to continue to have a relationship with, because it gives us an opportunity to provide our peers with getting their drugs checked safely and not feeling like they would possibly get in trouble or be breaking the law, or just that trust is really important with some of the peers that we work with. And so being able to provide some of our peers the opportunity to get their drugs tested was really good. And I hope it continues to get funding so we can continue to build, especially with us securing new office space in West Kelowna. So hopefully, like, inviting the team to come to our space and possibly provide that service in the West Kelowna community as well. Something we haven't talked to Lauren about, but hopefully we can make something happen. And yeah, just providing the opportunities to continue to get poison drugs right now on the street tested. Thank you.
Thank you for sharing that, Heather. It's been super just so valuable for us to partner with Can Do and the things that we've learned from Heather and other people who are part of that group. And yeah, just hearing people's stories and being a part of that, I know Can Do is so critical in being able to move this work forward. So I'm really excited that they got office space on the west side. We have to go see it. And Heather, I don't know if you want to maybe drop Can Do's contact information in the chat there. If not, one of us can probably do that as well here for you. But thank you. So I think we'll move into explaining a bit more about the drug checking process. So Adrian, if you want to talk about how that works.
For sure. Thank you. My name is Adrian. I use he, him pronouns. I'm a second-year nursing student. I work on the team as a drug checking technician. I'm from the Secwepemc Nation, but I'm taking a Zoom call from the traditional unceded territory of the Silks people. So how to package a sample. Ideally, this is how samples are packaged in a safe space with PPE as needed before being received for checking. Each sample needs to be about the size of a grain of rice in order to use it on our FTIR machine. The sample is placed in the middle of a piece of tinfoil and folded so that the sample won't come out. The tinfoil is then sealed in a plastic bag. The plastic bag is then placed inside the envelope along with a collection sample form, and the envelope is sealed. This is how we receive samples from clients, and clients can find materials to package their samples from HaRT or other local harm reduction organizations. Yeah, a little more about the sample collection form. This is an example with some of the data we hope to collect from the clients. Starting from the top left and moving right, we have the date of when the sample was bought, where it was bought, and what the sample was bought as, not what they think it is. This information is really important for drug alerts. We ask if it is pre or post use, whether it is used drug paraphernalia that we are checking. And on the bottom, we have a space for any important notes that the client would like to let us know, which is especially important if they have any strange reactions. And on the right side of the slide is how the client would like to be contacted, whether through email, phone call, text, or through an agency. We always like to clarify the contact information and who in the organization will pass along the information. For anyone filling out this form on behalf of a client, it is very important to get the client's consent to share any of the information, and these forms are destroyed as soon as the sample is analyzed, and any identifying information is not stored in the databases. And the drug checking tools and process here is some of our tools include the Fourier transform infrared spectrometry machine, also known as an FTIR, and test strips. Recently, I became a certified FTIR technician, and the training process involves a few hours of online modules, a minimum of 30 hours in-person practicum training, as well as an online exam to demonstrate the ability to navigate samples and articulate the results of the sample to the client. The FTIR, in its essence, shoots a laser through the sample, and the signal is then sent to the laptop. The signal will show up on the laptop as a line where the technicians will then analyze and compare the line with the chemical libraries to figure out what chemical components are within the sample. This data is then entered into a database, the sample is photographed, and results are delivered to the client. The FTIR tells us the components of a sample present in the concentration of 5 to 10% or more. Every sample is then dissolved in a test tube and shaken. Then we use fentanyl test strips as well as benzodiazepine test strips to dip into the liquid. These test strips are more sensitive and will confirm the presence of these two substances. Thank you.
And as with everything, there's limitations, and that's also true with the FTIR and our work there. The machine, for instance, like Adrian just mentioned, can only detect substances in greater quantities of 5 to 10% of the makeup, making more potent substances like benzodiazepines more difficult to detect. Even though benzodiazepines might be in a lower concentration, they're still potent at that concentration. And like David said earlier, benzos are not reversible through naloxone as well. And we also have a limitation of what we call the chocolate chip cookie effect, where much like a chocolate chip cookie, there's not chocolate chips in every bite. And so the substance is not distributed evenly throughout a substance or a sample that we get, and we might not detect every single substance in a given sample. Yeah. And also there's sometimes some difficulty with certain substances that might be given to us that might make it more difficult to analyze substances that maybe are in liquid form or other are often more difficult to analyze in the FT.
Cool. Thanks, John. My name is Fahmi Bahardin. I am the Executive Director here at Living Positive Resource Center. I go by he, him, his pronouns, and I'm calling in today from the Okanagan Silk Nations. LPRC is very privileged and very thankful for the collaboration that we've had with the UBCO HaRT team. What we are is a partner that has been working with them since, I guess, would be January this year. We're lucky to be able to be a hosting site and also a sample drop-off site. The connection that we have with the HaRT team means that there is a connection between the HaRT team and also the community members and the peer workers in the area. We become a designated point of contact for the people in this area because, as you saw with the scheduling, the HaRT team travels quite a bit throughout the area. But as a base here in downtown Kelowna, we are able to respond to requests and questions from people in the community. As we are also a harm reduction facility, we can also provide harm reduction supplies to the people in the area on top of the drug checking services. When I say that we are a hosting site, we mean that the partners come here. The HaRT team comes here every Wednesdays, once a week. And prior to their arrival, we make sure that they have a space. In our case, we use the boardroom. And they basically just set themselves up there for the 4 hours that they're here. We make sure that everything is sanitized, they have access to the water, power for their laptops, for the drug checking, test strips, and stuff like that. And then the other thing that we do is that we also work as a sample drop-off locations as well. What this means is that just because the HaRT team isn't here every day, we are able to receive samples from the community the entire time that we are open. In our case, it's Monday to Fridays, 9 to 5. So that folks in the community who might not be able to come in and drop off their samples during that Wednesdays are able to come in another time. If they come in outside of office hours, they can also call us and make an appointment to drop off. Because it's a very quick, just like a 2-minute, package the sample, give them the information and go on. We also work as a designated results for as well, because some of the folks that we noticed in the beginning of the collaboration is that some folks might be more comfortable talking to us because we have already a connection with communities and the client members. So they're more comfortable getting the results through our organization rather than the drug checking team. And what that means is what is required as a drop-off site in the hosting. We'll go over to the next slide. Yeah, so as I mentioned, one of the reasons why we exist is so that we can facilitate that low barrier use. Folks can bring in the samples from a more diverse population as opposed to just the people who have connections with the HaRT team. And also builds the community relationships because we are also connected to a lot of other different organizations as well. As a staff member here, we do expect everybody who is on site and will be available during those office hours to be able to give back to the community any questions that they have in regards to the drug checking, because we don't necessarily want to refer all those simple, easy questions to the HaRT team when we can do that ourselves. Some of the physical requirements and limitations that you have to consider being hosting a drop site is to make sure that you have a client consent to make sure that their samples are included and also getting all their contact information. We suggest having a lockbox so that drug samples can be stored away safely and only 1 or 2 people would have access to it and will be able to open that lockbox and pass the samples over to the HaRT team whenever they come here. We have supplies, as I mentioned, thankfully we are harm reduction supplies. So we have things such as like Ziploc bags, foils, envelopes, and stickers to make sure that the samples, when we get them, we're able to package them in a way that doesn't contaminate them or spill all over. As I mentioned as well, since we do provide other harm reduction supplies, all the staff members and all the volunteers who work here are also informed and able to provide information not just on the drug checking, but other harm reduction supplies. We also give out fentanyl test strips when they're not here. We give out naloxone supplies and all those other stuff that come in parallel with the drug checking services. As a hosting site, some of the tracking that we might do might be different, as I mentioned, because some of the clients might want the results to come back from us. What we also recommend is having a tracking system for the staff members. For example, for us here, we just have a board that doesn't have any identifying information, but we develop a little collection number based on the samples that we receive and what day it was. And we keep a result of it with no identifying information, just so in case they can't get in touch with the drug checking team, we have a copy of that. But same with the drug checking team, as soon as they get the results, we do shred all that information and we don't keep them around. And if we go to the next slide, we just have a couple of different copies of the physical stuff that we have. On the left-hand side, that is an example of the lockbox that we have. We have this, and there's an offshoot room that clients don't have access to. I have a copy of the key, and other staff members have a copy of the keys as well. So it's just basically just a mailbox that we get the drug samples. It's all prepackaged. We slide it in there, and then we just leave it there until the drug checking team comes in. It is bolted to the wall, so we had a concern of like potentially any sort of like people wanting to get access to that. So we just make sure that it's secured and put away. We have the collection record, and as I mentioned, that's more so for us as staff members at the hosting sites to be able to get in touch with the clients themselves. We just developed a little collection number so that if they do call, we have a reference. We don't need their name or anything like that. As long as they can quote their collection number, we're able to do that. When they come in and drop off their samples, we give them our business cards. We just write the collection number. And if they prefer that a specific staff member shares a result, we just put the staff member in there so that we can share that result with them. The envelope that we have on there, again, is just so that we have a way to track the client. So we when we get the client's samples, we seal them off, and the only person that will open it next time is going to be the drug checking team when they get here to do the sample testing. And that's all that I have to say for that. Thank you.
Thank you, Fami. We really value our relationship with all of our different community partners and where we do drug checking. And as you can see from all the things that Fami just said, they put a ton of effort into making sure that things run smoothly for when we arrive and how things get communicated to clients. So on our end of things, when we're sharing results, we always make sure that our work remains confidential and anonymous. And we provide results exactly as clients request on the sample collection form. So at the bottom of that form, they can indicate if they would like an email, a text, a phone call, or if they want that through another organization or a peer worker. So we always go about sharing results that way. And when we're sharing results, we'll include the appearance of the sample and the expected substance. And we usually include the date we received the sample or when it was purchased. And that's usually helpful for clients just to keep track of if they have multiple samples or that kind of thing. It just helps them remember exactly which one it was. And then we include the results from the FTIR as well as our test strips. And we try to do that all in plain language. So rather than saying something like erythritol, we'll say we found sugar. We'll include that name as well, just in case they want to know like the chemical makeup, but we try to make things kind of as low barrier and as easy as possible. And then we also provide the significance of those results. And after we give them that information, we include some disclaimers. So similar to the limitations that John was sharing earlier. And at the bottom of the email, we always include links to our services and other drug checking websites, or if we're sharing them in person, we'll just go over those things in conversation and let them know what different resources are available, basically. And it's nice too when we're having the conversation in person over the phone, because it can be a little bit of a more personalized chat about exactly what they need and what sort of things the community can offer them. So we have a bit of an example here just of what our results emails look like. So you can see here, we always started off by saying, here are the results checked from the sample on whatever date they were checked, where it was checked and who it was checked with. So there's transparency on our end of somebody knowing exactly who handled the sample, where, and when, kind of thing. And then this sort of table here just shows all that information I just went over. So this is how somebody would see their results coming back if it's through an email. And then we try to follow the same kind of templates whenever we're sharing results over the phone or that kind of thing, or similarly over text. So you can see there's comments from the sample collection form. So that can kind of trigger someone's memory as well. Like, oh yeah, I want to know if that thing has benzos in it. And then we'll share what we found, the significance of that, what that means, if it's something to be really careful about or that sort of thing. And then on the next slide here, Tori will get into a bit more about the disclaimers that we share.
When we send drug checking results to the client via email, this is a disclaimer that accompanies the results. This disclaimer is used to provide an understanding of the work that is being done and how to take proper safety measures. Firstly, it is stated that although the drugs have been checked, that there should still be caution when using and to never use alone. It is also important to carry a naloxone kit, which we can provide to those who need it. There is also the number of the overdose response service in case it is needed, along with the links to services for people who are using alone to help keep them safe in case of overdose. Secondly, we note for the client that the FTIR drug checking machine results are only approximate, as the machine can only find drugs that make up 5 to 10% of the sample. Test strips are more sensitive when trying to detect fentanyl or benzodiazepines at smaller concentrations. Lastly, the results are only a small picture of what is present in the sample. This goes back to the chocolate chip cookie effect, which was explained in a previous slide. This effect is used to best explain to the client that what is found in the sample may or may not be present in the rest of the drug. The rest of the disclaimer speaks to where one can find more information and has contact information for our services and to thank those who use the services. Although this disclaimer may be seen to clients and partners as routine, it is important as it is full of information that can help keep new clients safe.
So you can see we really like to just reiterate what the limitations are and provide as much clarity around the results as possible for clients that we're chatting with. When it comes to sharing results, aside from the kind of personalized results that go out, we like to talk to people about ways that anyone can really share the results from our work. So we post weekly summaries of the drug checking results from all of the communities and locations combined. And so you can find that on our social media, which we'll post at the end here. But you can share those posts, you can print them out, share them with clients or family members, or however it's relevant to your work. And we find it's really helpful just for getting a picture of exactly what's happening in the community right now related to the toxic drug supply. So there are some organizations too that like to print these out on posters and have them up around different harm reduction organizations in the community. Some folks like to put it out on a whiteboard, especially if there's some significant results, include them in newsletters. There's lots of ways that people can get involved with sharing results, even if you're not a direct site that's working with us for drug checking or sample collection. For sharing results, if you're working with us as a sample collection drop-off site, we really like to have a designated results person that we can chat with, and we can send those results again over text, email, phone call, anything like that. And we like to provide results the same day as much as possible when we have those results to give people. So if you're thinking about being a sample collection drop-off site, just making sure that the staff person who's communicating those results is available that day. And some folks like to have sort of a binder system, like Fami was saying. He showed you guys the way that they like to do that. There's also a raffle ticket system some people like, where one ticket stays with the sample, the other ticket goes to the client, and then they just reference that number. So there's lots of ways that people can get involved with sharing results. And yeah, we're always happy to chat more about that. Some of the frequently asked questions that we get is how long it takes to check a sample. So typically from start to finish, it's roughly 30 minutes, but it can vary a lot. So if we're just going off of samples that have been dropped off, we just go through them sequentially. But if there's someone who shows up in person with a sample, we tend to prioritize that so we can run it through right away and talk to them right away. Once in a while, we do get samples that are kind of more complicated and we have a harder time pulling out an analysis that we're comfortable sharing. And in those cases, we like to flag it and review it with the folks at BCCSU and kind of get their opinion on it before we share those results. And then for used paraphernalia, we talked a little bit about this earlier, but we can take things like used cookers or pipes, anything like that. If there's residue left in there, we can scrape it out and use that for testing. And sort of like John said earlier, once it's been used and is kind of caked into something like that, it does sort of affect the chemical profile, but we can still get results from that. Yeah, so far for the program, we just wanted to share a little bit about what that's looked like. So from January to April, we were able to check 263 samples, and about 35% of those samples contained benzodiazepines. So as David said earlier, that's quite dangerous because I'm trying to think of all those samples we had that had benzos in them. I don't think there was any one person looking for benzos. So that was an unexpected thing that significantly increases their risk of overdose. The majority of samples we got were expected to be down, and we are seeing more upper type drugs coming through as the summer goes on, which isn't too uncommon, especially with being in the Okanagan, being a big tourist area, seeing more of that. And anecdotally, we're hearing from our different partners in the community that this program is helping to prevent overdoses. It's helping to decrease stigma, and it's increasing conversations around the toxic drug supply and concerns with that. So I will pass it over to the next slide so Ilana can tell you a bit more about the resources.
So in addition to staffing, program costs from funding go to supplies that make our services possible, such as providing alcohol swabs, medical gloves, small medicine cups, masks, envelopes, travel expenses, fentanyl test strips, benzo test strips, and more that go into making what we do possible for the public. The HaRT team also receives requests from individuals and organizations on how they can donate to us. Such donations can be made through one of our community organizations, Living Positive Resource Center. And this can be done by selecting General on this form that is linked to the slide and add a note to the message box saying Harm Reduction Program. So this slideshow is going to be emailed out at the end of the presentation as a PDF, and the link to this form will be accessible. The HaRT team finds immense value in our interdisciplinary communications and partnerships. For example, I'm a third-year engineering student, and in my position on the HaRT team, I work with nursing students, social work students, and art students, all with unique perspectives that come together to make this work happen. We want community members to use their own unique strengths to help collaborate with us in various ways. Collaboration is an incredibly important aspect of what we do, and anyone is encouraged to be a part of the work with the harm reduction team, regardless of if they're a UBC student or a community member. So since we have a limited capacity, being that we're a small team, any help with promoting awareness of our team is extremely beneficial to us. So sharing overdose awareness and prevention resources and promotional materials, so you can put up posters, share on social media or emails. Sharing results from drug checking is also incredibly valuable, as well as advocating for better policy and booking drug checking services, which require additional funding. Providing sample collection kits or party bottles and becoming a sample drop site are also very effective ways to work with us. The UBCO harm reduction team can be reached in a variety of ways. So for UBCO contacts, we have Lauren Ayer's email, which is checked 2 days per week, as well as the campus health email listed on the screen. Community member contacts can connect with the harm reduction coordinator at Interior Health email. And then for any drug checking related contacts, clients can contact our UBCO HaRT email or phone number, which are both checked during drug checking hours. Our website, heartok.ca, shows location-specific contacts, and then any Interior Health harm reduction coordinators for any drug checking inquiries can be contacted by the harm reduction coordinator email as well.
All right, so what's next? As we near September 2021, we were preparing for the end of the current FTIR contract with Interior Health. As they were reviewing proposals to decide who will hold the ongoing contract for the FTIR. With students returning in the fall, we will continue to offer harm reduction, including drug checking through fentanyl test strips and benzo test strips. Currently, we are also working on the United Way Youth Initiative grant, which involves supporting youth-focused harm reduction in Penticton the last Friday of every month. We are also collaborating with FNHA, First Nations Health Authority, to expand our awareness and support for harm reduction through a First Nations lens. We're also delivering a hybrid drug checking model in communities where we work out of Interior Health buildings as well as community outreach centers. Another objective for us is continuing to support faculty and student engagement within research related to harm reduction. Thank you.
Thanks, Adrian. So just to refer back to that communication slide too, FAMI has added in that for any organizations that are interested in chatting about experiences as a sample collection drop site or what it would mean to be set up as one, FAMI is also happy to chat with people. So in the slides that we send out following the presentation, that will include his contact information as well. So just to add that in, and kind of going back a little bit again for the party bottles that John was talking about. This is them in real life. This is what the packages look like. So that's how the image came out on the bottles, and lots of goodies in there. It's pretty cool. So we also want to include a bunch of helpful websites here for people who want to learn more about harm reduction or drug checking. These are a lot of really good websites to take a look at. So again, that'll be in the slide deck for folks to peruse. And then finally, on our last slide here, we just have some information about where you can find us on social media, as well as our website. So we can leave that up here as we take questions. That's the end of our presentation. So Fami is sort of our moderator for questions. And if you don't want to be sort of publicly noted with your question in the chat, you can send Fami a private message and he will relay that. But at the moment, Fami, were there any questions that came through during the presentation that we can answer now?
No, there was not any questions on there. So I feel like we can just open the floor to anybody who either wants to just get that stuff on mute and ask a question or send me a message directly and I can bring it to the group.
Great, thank you. Yeah, we've got probably another 20 minutes here if anyone does want to ask us questions about any of the harm reduction work that we are doing. Thanks, Stephanie and Leslie. We appreciate you guys and all the work that you do as well. So we're glad that you're here. Well, I think if there's no questions coming through, we're happy to get questions emailed to us or chat with people privately about things. Again, that's our social media there on the slide, and you can also find us at hartok.ca, which is HART.ok.ca. And in the chat, I will also throw a couple other websites that might be helpful. campushealth.ok.ubc.ca has lots of information about the campus health work. So that is in the chat there for folks as well. Great, thank you so much.
Can I jump in for a sec? There's still people on the call, right? It's Leslie. I'm
Yes.
just a
Yes,
regional harm
Leslie.
reduction coordinator with Interior Health. And I just want to say, you guys did a phenomenal job explaining the service and all of the work that you're doing in community. And I know you talked about how people could become a drop-off site, and I think that's super important. And I really hope that if we have some community agencies represented on the call today, and I know that we do, that if they're able to give consideration to that, I think that would be so amazing, because we know that the easier it is for people to drop their samples off somewhere and potentially even do so, anonymously, it can make such a huge difference in getting more drug checking done. And also just helping us get a better sense of what is in our drug supply. So I guess I just wanted to say before we wrap up that if we have community partners on the call that are thinking about, their capacity to do this, I would say it would just really help to support the work that you guys are doing.
Thanks, Leslie. I just wanted to expand on that, just for community partners consideration. Something that was really surprising for us as a hosting partner was the fact that we expected a lot of the samples to be dropped off where clients who were already our clients, but what we actually saw was a completely new client demographic. A lot of the people who were accessing our service, and specifically for the drug checking services, were not already clients who were accessing our harm reduction service. So it really expanded our demographic and really showcased that something like this was definitely needed, and it wasn't just for folks who were already accessing harm reduction service. A lot of them were people who were using recreationally and realized that the service was there and was like, oh, I should probably get on board with this too. So yeah, that's for consideration of expanding your service to reach out those people who might not be accessing your current services.
Yeah, thanks for sharing that lesson, Tommy. It's really interesting to see just how, for different sample collection sites, yeah, like you're saying, how it's changed the people that they're seeing, or just the drugs that are coming through. So yeah, and I think Amy said in the chat there too. Hi Amy, if you're still here, but she's been instrumental in setting up the sample collection box at Burdock House in Penticton, and it's gone really well there as well. So there's lots of people out there who have different ways of doing this, and all the ways are working well. So lots of different ways to approach it for sure. Yeah, folks are free to go if you don't have other questions or comments or anything that you wanted to share. We really appreciate everyone coming out today, and we will be sharing the slides as well as the recording of the presentation. So thank you.